The trauma bay doors burst open at 11:47 p.m., and Nurse Lena Carver stepped directly between three armed soldiers and a man bleeding out on the gurney. "Move," the lead soldier ordered. His hand went to his sidearm. Lena didn't flinch. She had stood in places where that kind of threat was the background noise of every waking hour. She had kept men alive in conditions these soldiers had only read about in classified briefings. She had done it without equipment, without backup, without sleep, in temperatures that cracked the instruments and made the blood thicken in the IV lines. But standing here in the fluorescent glare of Harmon Ridge Medical Center in Dunmore Falls, Wyoming, wearing her nurse badge and her hospital-issue scrubs, she looked like someone who had no business being in the room. That was the problem. That was always the problem. Before we go any further, if you've never been to this channel before, hit subscribe right now because we release new stories every week, and you do not want to miss what's coming. Hit the like button if you're already hooked, and drop a comment below telling me what city and country you're watching from. I want to see exactly how far this story travels. Now let's go back to Dunmore Falls, Wyoming, and to the nurse nobody took seriously, until the night she became the only person who could save them all. The shift started the way most Tuesday nights did at Harmon Ridge Medical Center, quietly enough that it felt like a trick. Lena Carver arrived 12 minutes early, the way she always did, poured herself a coffee she would never finish, and reviewed the board before the outgoing charge nurse had a chance to brief her. It was a habit she couldn't shake from another life, one that her colleagues had long since stopped questioning. They called it obsessive. She called it survival. Dunmore Falls was not a city that saw a lot of action. It sat in a long valley between two mountain ridges in southeastern Wyoming, a town of 40-some thousand people that existed mainly because of the highway junction, the agricultural co-op, and Harmon Ridge Medical Center itself, which served not just the town, but 4 surrounding counties. The hospital wasn't large: 212 beds, a small but functional trauma bay, an ICU that had 6 rooms and, on most nights, more nurses than patients. Lena had been working there for 3 years. She had come in from nowhere, applied online, presented a nursing license, passed her credentialing review, and showed up on her first day with a bag lunch and 0 fanfare. She was good at the job, quietly, consistently good. She drew blood on the first stick. She caught medication errors before they reached patients. She noticed things, subtle changes in breathing, the faint mottling on a patient's forearm that suggested something systemic, the particular way someone held their arm when the pain was deeper than they were admitting. Other nurses noticed her noticing. Some of them appreciated it. Some of them didn't. Dr. Raymond Doyle noticed too, but not in a way that worked in Lena's favor. Doyle was Harmon Ridge's trauma director. 49 years old, silver-haired, the kind of physician who had spent 30 years being told he was exceptional and had internalized it as fact. He moved through the hospital like a man who believed the building had been constructed around him specifically. His opinions were not suggestions. His assessments were not open to review. The first time Lena had contradicted him, gently, carefully, with evidence in her hand, he had looked at her the way a person looks at a parking ticket, briefly, with mild irritation, and then not at all. That was 6 months ago. She had been right. The patient had presented with what Doyle called anxiety-related hyperventilation. Lena had flagged the ECG irregularity herself, gotten the attending to look at it, and the patient went to the cath lab 40 minutes later with a widowmaker in progress. Doyle had not acknowledged it. By the time Tuesday night shifted into Wednesday morning, Lena was 3 hours into her shift, managing a 41-year-old man with a dislocated shoulder and an elderly woman who kept insisting she had not, under any circumstances, slipped on her own bathroom floor. The radio crackled at 12:14 a.m. Lena heard it from the nurse's station, not the hospital radio, but the county scanner that Julio, one of the ER techs, kept on the shelf behind the supply cabinet because, as he put it, they always heard things on the scanner 20 minutes before dispatch called them. Julio had good instincts. The scanner had saved them prep time more than once. What came through at 12:14 a.m. was not a standard dispatch call. The voice on the scanner was clipped, controlled, the kind of voice that belongs to someone who has been trained to speak calmly in situations that are not calm at all. Multiple casualties, Highway 9 underpass, military convoy, requesting trauma activation. Lena was already moving toward the supply cabinet before the voice finished the sentence. Julio looked at her. "You heard that? Pull the trauma kits, all 3, and get someone to clear Bay 2. We should wait for..." Pull the kits, Julio. He pulled the kits. The call came through official channels 4 minutes later. The charge nurse, Sandra Okafor, a brisk and competent woman whom Lena genuinely respected, activated the trauma protocol and started moving people. The attending physician on duty was Dr. Phillips, a hospitalist who moonlighted in the ER on overnight shifts. He was technically qualified for trauma response. He was also, at that particular moment, in the middle of a complicated situation with a pediatric patient 2 floors up and had radioed down to say he would be there as soon as he could. The ambulances arrived before he did. 3 of them, in a staggered convoy, lights going, the back doors opening before the vehicles had fully stopped. The paramedics were fast and efficient and clearly rattled in the way that professionals get rattled when something is bigger than the protocols they trained for. The first gurney came through the doors with a young soldier, male, probably 24, a field dressing wrapped around his left thigh that had gone dark red all the way through. The second gurney carried a woman, also uniformed, unconscious, with an oxygen mask already in place and a paramedic manually bagging her. The third gurney was the one that made Lena's stomach tighten. The soldier on it was gray. Not pale, gray. His lips had a faint blue cast. His chest was moving, but not the way it should have been. And the movement was wrong on the left side, the rise not matching the right. The effort visible in the muscles of his neck because the primary mechanics were failing and his body was recruiting everything else it had to compensate. She had seen that before. She had seen it in a place she did not talk about, on men who were running out of time in a way that could be stopped if you were fast enough and knew what you were doing. Bay 3, she said, already positioning herself at the head of the gurney. He needs a chest assessment now. The paramedic transferring handoff looked at her badge. Where's the physician? On his way. What's his pressure? 84/60 when we loaded him. Dropped to 78 in transit. Breath sounds? Diminished left side. We thought maybe hemothorax. Lena pulled her stethoscope. She was already calculating. Hemothorax was possible, but the trachea was shifted. Barely, just a few millimeters. But she could see it, the slight deviation to the right, which meant the problem was pressure, not just blood. Tension pneumothorax was a killer that moved on its own schedule, and its schedule did not accommodate waiting for the attending to finish upstairs. She listened to his chest for 4 seconds. She needed 3. This isn't hemothorax, she said, loudly enough that Sandra heard it from 2 feet away. Where's Dr. Phillips? Still upstairs. Radio him. Tell him Bay 3 is a tension pneumo. Tell him the patient has maybe 6 minutes before this becomes unrecoverable. Sandra was already reaching for the radio. That was when the door opened. 3 soldiers came through it. Not wounded, not patients, but uniformed and armed and moving with the kind of purpose that made the room recalibrate. The man in front was a sergeant, broad-shouldered, his face carrying the particular expression of someone who has been awake for 36 hours and is running entirely on adrenaline and mission focus. He looked at the trauma bay, looked at the gurney, and looked at Lena with the kind of appraisal that took less than 1 second and landed exactly where she expected it to land. Who's the physician? He demanded. Not here yet, Sandra said. He's been notified. Then who's treating my soldier? I am, Lena said. She did not look up from the patient. The sergeant came closer. You're a nurse? Yes. Where's the doctor? I told you, notified, incoming. Your soldier does not have time to wait. She could feel the sergeant's attention on her like a physical pressure. She ignored it. She was watching the patient's neck veins, distended, which confirmed the pressure buildup, and monitoring his blood pressure on the cuff the tech had just applied. And she was also doing the quiet math that she had learned to do in environments where the math was the difference between a body bag and a medevac. Step aside, the sergeant said. Wait, we'll wait for the doctor. If you wait for the doctor, you will be writing a letter to his family. The words came out flat, not dramatic, not intended to shock, just accurate. The sergeant's jaw tightened. You're not authorized. Sergeant. She finally looked up, directly at him. I understand your concern. I understand you don't know me and you have no reason to trust my assessment. But your soldier's trachea is deviated, his left lung sounds are absent, and his pressure has dropped 15 points in 8 minutes. If I don't decompress that chest in the next 4 minutes, the pressure will shift his heart far enough that it cannot pump. When that happens, it doesn't matter how many doctors show up. Silence. Not agreement, not permission, just the pause of a man calculating risk against risk. One of the other soldiers, younger, a private, his name tape-reading Ashby, looked at the sergeant. "Sarge." The sergeant stepped back. Not much, but enough. Lena turned back to the patient. The procedure took 90 seconds. A 14-gauge needle, second intercostal space, mid-clavicular line. She heard the rush of air that told her she was right, felt the patient's respiratory effort immediately begin to ease, watched the oxygen saturation tick upward on the monitor, 91, 93, 96, and felt the particular kind of relief that had nothing to do with satisfaction and everything to do with the fact that the math had worked out in the right direction. Dr. Phillips arrived 40 seconds later, slightly out of breath, taking in the bay with rapid professional assessment. "What happened?" he asked. "Tension pneumo," Lena said. "Decompressed. He needs a chest tube now and imaging to rule out associated hemothorax. Pressure is stabilizing. BP is 89/62. Phillips nodded, pulling on gloves, already in motion. He didn't ask how she had gotten to that assessment. He could read a monitor. He could see a stable patient. He went to work. Lena stepped back, stripped her gloves, and was already moving toward the other patients when she heard the voice behind her. "Nurse Carver." She turned. Dr. Doyle was standing at the entrance to the trauma bay. He had not been in the building when the ambulances arrived. He was here now, still wearing his coat, which meant he had come in from outside, which meant someone had called him. His face was arranged in the particular expression he used when he had already decided something and was going through the motions of pretending it was a conversation. "My office. Now. I have patients. Sandra can cover your patients. My office. Now." The sergeant was watching. The private was watching. Two of the nurses near the station were carefully not watching, which was the same thing. Lena followed Doyle. His office was down the corridor from the trauma bay, a corner room with a window that faced the parking structure and a desk that held approximately 4 times more paper than any physician needed. He sat behind it. He did not invite her to sit. "What you did in there," he said, "was a serious violation of this hospital's protocols. The patient was receiving care within an appropriate. The patient had a tension pneumothorax and no physician present. The attending had been notified but had not arrived. The patient had approximately 4 minutes. That determination was not yours to make." "Then whose determination was it?" She kept her voice level. "The attending who wasn't there? The surgeon who was in the OR? Yours, from wherever you were when the ambulances arrived?" Doyle's expression didn't shift. If anything, it settled. "I'm filing a report with nursing administration tonight," he said. "I'm recommending your removal from trauma rotation pending a full review. If that review finds what I expect it to find, we'll be discussing the status of your employment." Lena looked at him for a moment. Not with anger. With something that took her a moment to name, and then she named it. Exhaustion. Not physical. Something older. "The patient is alive," she said. "That's not the point. It's the only point that matters." "In this hospital," Doyle said, "I decide what matters." She left his office. She went back to her patients. She finished her shift. She did not sleep well afterward. The formal notification arrived in her inbox at 7:52 a.m. A message from nursing administration, signed by Director of Nursing Pam Whitfield, informing Lena that pending an administrative review of the previous night's events, she had been temporarily reassigned from the trauma and emergency department to general medical surgical floors. The reassignment was effective immediately. Lena read it twice. Then she set her phone face down on the kitchen table and sat with her coffee for a long time. She thought about the patient in Bay 3. She had checked before she clocked out. He was in the ICU, stable, chest tube in place, starting to talk. The other 2 soldiers were being treated and were expected to recover. The soldier with the thigh wound had needed surgery, but the bleeding had been controlled, and the prognosis was good. She thought about what she could say in the review. She thought about the records she could pull, the timeline she could document, the fact that every clinical decision she had made was defensible to anyone with a basic understanding of emergency medicine. She thought about other things too. Things she didn't allow herself to think about for very long. There was a box in her closet, literal, physical, a military-issue storage container she had carried from her last posting to her apartment in Dunmore Falls. She had not opened it in 3 years. She did not open it now. But she was aware of it the way you are aware of something behind a wall. Not visible, but present, and dense with weight. She reported to the medical surgical floor at her next scheduled shift. The nurses there were pleasant. The work was competent, meaningful, nothing she was ashamed of. She changed dressings, managed IV lines, coordinated with physical therapy on 2 post-surgical patients, and spent 40 minutes with an 80-year-old man named Gerald, who wanted to talk about his late wife's cooking and genuinely did not seem to care that Lena had never made a proper beef stroganoff in her life. "You listen," Gerald said. "Most people don't." "You're interesting," she told him. He laughed, which made his incision pull, and then he stopped laughing, and they both pretended that hadn't happened. On the 3rd day of her reassignment, she was working an afternoon shift when one of the ER nurses appeared at the end of the hall and caught her eye with the particular look that meant something was happening. Lena finished what she was doing, handed off to her colleague, and walked down. "What is it?" The nurse, a travel nurse named Priya, who had only been at Harmon Ridge for 2 months, and therefore had not yet fully learned which conversations to avoid, leaned in. "They're asking about you, people from outside." "What kind of people?" "Came in this morning, 2 of them. Civilian clothes, but they're not civilian. You can just tell, you know, and they were asking at the front desk about the staffing roster for the trauma bay Tuesday night." Lena was quiet. "Did you hear what I said?" "I heard you." "Do you know what that's about?" "I don't know," Lena said. Which was true. She went back to her patients. That night she drove home a different way than usual, an old reflex, one she hadn't used in years, the kind of route variation that was written into her somewhere below conscious decision-making. She noticed herself doing it about halfway home and didn't stop. The call came 2 days later. She was at the hospital, finishing a charting session before the start of her shift. Her personal cell phone, the number she gave to almost no one, buzzed with a call from a number she did not recognize, but the area code was one she did recognize. From a period of her life she kept in a locked room in the back of her mind. She answered it. "Lena Carver." A pause. Then, "This is Major Tara Winslow, out of Fort Braxton. We need to talk." Lena was quiet for a long moment. "I'm at work," she said. "I know. I'm sorry to call this way. I'll make it brief." Another pause. "We've been reviewing what happened Tuesday night, the convoy incident." I gave my account to the attending. "We've read that account. What I'm calling about is something else. We've been tracking a supply discrepancy connected to the convoy that was hit. Some of the materials used in the incident were traced back to a source in Dunmore Falls." A brief pause. "We'd like to meet." Lena looked at the wall for a moment. "When?" "I can be at Harmon Ridge tomorrow morning." "There are things I can't discuss." "I know," the major said. "We're not asking you to discuss those things." After she hung up, Lena sat for 3 minutes without moving. Then she went back to work. She was efficient, she was quiet, she answered questions in brief, complete sentences, and did not offer anything beyond what was asked. The nurses on the floor noticed nothing different about her. The medical surgical patients received the same steady, careful attention they had received every day. But the math was running in the back of her mind. A supply discrepancy. Traced to Dunmore Falls. A convoy hit in a way that was being investigated rather than categorized as accident. People in civilian clothes asking about the staffing roster for the specific night when soldiers from that convoy came through the ER. And Dr. Doyle had filed his complaint within 2 hours of the incident. She had assumed that was about professional hierarchy, about a man who didn't like being shown up in his own department, about the kind of institutional reflex that punished competence when competence arrived in the wrong package, wearing the wrong badge. She was revising that assumption. She was revising it carefully, the way she had been trained to revise assumptions, methodically, without letting the revision outrun the evidence, but without dismissing what the pattern suggested just because the conclusion was uncomfortable. She finished her shift. She signed out. In the parking lot, as she was walking to her car, she noticed the sedan parked 2 rows over that had been there when she arrived, and was still there now in a spot that was not clearly marked, but was also not, technically, a visitor space. The kind of parking that said, "We're here, but not officially." She noted the plate without looking like she was noting the plate. She drove home. The box in the closet stayed closed, but she was thinking about it. Major Winslow arrived at 8:15 the following morning, alone, in the same unremarkable sedan Lena had seen in the parking lot. She was somewhere in her late 40s, efficient-looking, with the particular economy of movement that came from years of operational discipline. She did not ask to use a conference room. She asked if they could walk, and Lena said yes. They walked the perimeter of the hospital's exterior grounds. It was cold. The mountains were visible in the distance, and the air had the clean sharpness of early autumn at elevation. "I'll be direct," Winslow said. "Please." The convoy that was hit Tuesday, it wasn't an accident. We're treating it as a targeted incident. The vehicle damage is consistent with a device, not a mechanical failure. Lena said nothing. "We've traced components of the device back to a supply chain that runs through Harmon Ridge Medical Center, specifically through a procurement contract that was modified in the last 8 months to route certain materials through a third-party vendor." "Who manages procurement here?" Winslow looked at her briefly. "That's one of the things we're looking at. You said you weren't asking me to discuss certain things." "I'm not. I'm giving you context." Winslow stopped walking. They were at the north corner of the building, out of sight of the main entrance. "Captain Carver. That's not my title anymore." "It's the name on the record we're looking at." Lena was quiet. "The classification on your file is still active," Winslow said. "You separated, but the record doesn't go away. And right now, in this specific investigation, your experience with chemical casualty management and your position inside this hospital make you one of the most useful people I've got. I'm a reassigned floor nurse under administrative review." "I know, and I know why." Winslow's tone was careful. Not apologetic, but something adjacent to it. "Whoever decided to put that complaint in motion, and I have a working theory about that, did so because your presence in that trauma bay was inconvenient. Not procedurally, strategically." The cold air moved between them. "You're suggesting," Lena said slowly, "that the complaint against me was designed to get me out of the ER before something happened." "I'm suggesting it's a theory worth examining." Lena looked out at the mountains for a moment. The first snow of the season had hit the high peaks the previous week, and they were still white, clean-edged against the blue. "What do you need from me?" "Right now, nothing. I need you to continue doing your job. I need you to stay available." Winslow reached into her jacket and produced a card, plain, with a number and nothing else. "If anything changes, if anything unusual happens, if anyone approaches you about Tuesday, about the procurement contracts, about anything that doesn't fit the normal run of a hospital workday." Lena took the card. "And if another emergency comes through that ER," Winslow said, "don't let them keep you off the floor." Lena said nothing for a moment. "That review is still pending," she said. "I know." Winslow looked at her steadily. "I'm working on that." They walked back toward the entrance. At the door, Winslow stopped. "One more thing," she said. "The soldier you treated Tuesday night, Private First Class Daniel Ashby. They tell me he's been asking who the nurse was." Lena thought about the young soldier she'd seen in the room, the one who had looked at the sergeant and said his name quietly, the one who had stepped back when everyone else was still deciding. "He was a patient's escort," she said, "not a patient himself. He says he watched what you did, says you didn't look like someone doing it for the first time." The door opened automatically, letting in a wave of hospital warmth. "I'm just a nurse," Lena said. "Sure," Winslow said. And then she walked back toward the sedan without saying anything else. Inside, the board had updated. 2 new admits on the surgical floor. A follow-up in Bay 1 that Sandra had flagged as potentially needing an upgrade to monitored care. Lena went to work. She was good at it. She was fast and careful and never wasted motion. The other nurses moved around her the way water moves around a stone. Not because she pushed them away, but because she was solid in a way that the current arranged itself around. At 2:47 in the afternoon, the scanner behind the supply cabinet crackled. Julio wasn't there. Lena was the only one in earshot. The voice on the scanner was different from Tuesday's, but more urgent, less controlled, with the specific compression of someone transmitting under pressure. "Multiple inbound, Highway 9 corridor again, second convoy incident, requesting full trauma activation. Be advised this is not standard blast trauma. Repeat, this is not standard. Requesting chemical." The transmission broke up. Lena stood with a supply cart under her hands and the card from Major Winslow in her pocket, and the scanner going to static. She counted to 3. Then she put the supply cart away and walked down the hall toward the ER. The walk from the surgical floor to the ER took 45 seconds at a normal pace. Lena covered it in 30, Not running, just moving with the kind of directional certainty that made people step out of the way without being asked. The trauma bay was already activating. Sandra had her headset on and was directing the incoming prep with the focused efficiency that made her good at her job, and the ER techs were pulling equipment and checking supply carts, and the whole room had that particular quality of controlled acceleration that preceded something bad arriving at the door. What the room did not have was a physician. Lena checked the board. Dr. Phillips was marked as on site. She scanned the bay. He wasn't there. She caught Sandra's eye, and Sandra shook her head once. Not here yet, working on it, and went back to her headset. Lena pulled a gown off the rack, gloved up, and took her position at the primary bay. No one stopped her. No one told her she wasn't supposed to be there. The techs were focused on the equipment, and the nurses were focused on the protocol, and in the churn of incoming trauma activation, a composed and gloved nurse moving to the head of the primary bay was not an anomaly anyone had time to question. She was aware that this was temporary. She was aware that the moment Doyle appeared, or the moment anyone checked the assignment board and noticed she was supposed to be 2 floors up, the conversation would shift. She filed that awareness somewhere and left it there. The ambulances arrived at 3:04 p.m. There were 4 of them this time, not 3, and they came with a fire department escort, which meant the scene had been complex enough to require additional resources, which meant this was not a clean incident. The paramedics were moving fast, but there was something different about them. A quality in their posture, a slight hesitation before they opened the back doors that Lena recognized as reluctance. Not fear of the patients, fear of whatever the patients had been exposed to. She caught the first paramedic as he came through. What are we looking at? He was young, maybe 28, and he pulled his mask down to talk and then seemed to reconsider and pulled it back up. Convoy hit. Secondary explosion, possible chemical. 3 of them have pulmonary symptoms, coughing, lacrimation, 1 with bronchospasm. 1 has blast injuries, that's more straightforward. Last one is... He paused. Last one is the one I'd start with. Show me. The 4th ambulance had pulled to the far bay. Inside, a soldier was lying on the stretcher in a position that told Lena several things before she could hear a single monitor alarm. The limbs were posturing slightly, not fully, but enough. And there was a fine tremor in the hands that didn't match the gross muscle tension in the neck and jaw, and the skin had a particular waxy quality under the oxygen mask, and the eyes, when she leaned close and opened the right lid gently, were pinpoint. She straightened. What did they use at the scene? She asked the paramedic. What antidote protocol? We didn't know what we were treating. We supported airway and transported. That was the right call given the uncertainty, but it meant the clock had been running since the exposure without intervention, and she didn't know exactly when that was. Pupil response? Bilateral fixed and pinpoint on scene. Secretions? Yeah, significant. Had to suction twice in transit. She looked at the monitors. Heart rate was low. 54. And the blood pressure was variable in a way that suggested something systemic rather than mechanical. The bronchospasm she could hear without a stethoscope, the particular tight wheeze of airways in crisis. She had seen this before, not in a hospital. The other nurses were coming to her now instinctively, the way a trauma bay orients around the most confident person in the room, which was not always the most credentialed one. He needs atropine, she said. 2 milligrams IV push now. And get pralidoxime ready. A nurse named Thomas, who had worked trauma at Harmon Ridge for 11 years and whose instincts Lena trusted, looked at her for exactly 1 second with an expression that said he was doing the math. That's organophosphate management, he said. Yes. You're saying chemical exposure. I'm saying the presentation is consistent with cholinergic toxidrome, pinpoint pupils, bradycardia, bronchospasm, hypersecretion, vesiculation in the hands. That's not blast injury. That's nerve agent or organophosphate compound. She met his eyes. Do you want to wait for the doctor? Tomas turned to the medication cart. Dr. Phillips arrived 40 seconds later, slightly breathless, having come at a run from wherever he'd been. He took in the bay with rapid professional assessment, and Lena gave him the handoff in 12 words. Probable cholinergic toxidrome. Atropine in progress. Pralidoxime ready. Phillips processed that in about 3 seconds, looked at the monitor, looked at the patient, and nodded. Dosing? 2 milligrams initial. Repeat at 3-minute intervals until secretions dry. Keep going. Going, he said, pulling on gloves. It was not the same as permission. It was not an endorsement. It was a physician with sick patients and a nurse who knew what she was doing, making the only rational call available to them in the moment, and they both understood that, and neither of them said so out loud. The atropine went in. They watched the clock. At 2 minutes and 40 seconds, the bronchospasm began to ease. Not fully. Not a resolution, not anything that felt like relief yet, but the quality of the wheeze changed, the chest rising with slightly less effort, the oxygen saturation lifting from 87 to 91. Second dose, Lena said. Give it, Phillips confirmed. By the time the second dose had been in for 90 seconds, the secretions were visibly decreasing, and the heart rate had lifted to 62, and the quality of the tremor in the hands had changed, the fine fasciculation beginning to settle. The other soldiers with pulmonary symptoms were being managed in adjacent bays. 2 of them were responding to bronchodilators, which was consistent with lower-level exposure, enough to irritate the airways without the full systemic involvement they were seeing here. The 4th soldier, the blast injury, was being assessed by Phillips's resident, who was more comfortable on that ground. Lena stayed with the critical patient. She was aware of the room around her, the noise level, the movement, the way the trauma bay had filled with more people than it should have, and was operating at a volume that made precise communication harder than it needed to be. She filtered it the way she had learned to filter it, keeping the information she needed and discarding the rest. She was aware specifically of the sergeant who had been there Tuesday night. He was standing at the edge of the bay, not obstructing, not demanding anything, just watching, with his arms at his sides and his face carrying something different from the authority it had worn 3 days ago. She didn't have attention to spare for what that expression was. What she had attention for was the patient, who had begun to show something additional, something that shouldn't have been there if this was a straightforward organophosphate exposure. The fasciculation in the hands had settled, which was correct and expected. What was not expected was the new pattern beginning in the left arm. Not the rapid fine tremor of cholinergic crisis, but something slower, more rhythmic, a pattern that her memory categorized before her conscious mind had finished the sentence. She reached for his arm, gently, and felt it. "Phillips," she said. He was 2 feet away, reviewing the chart. "He's seizing, partial, left arm." "I don't see—" "Look at his arm." Phillips looked. 3 seconds. "That could be tremor from—" "It's focal. Watch the progression." They watched. Over the next 40 seconds, the pattern extended, up the arm, touching the shoulder, never generalizing but unmistakably rhythmic, unmistakably purposeful in the way that neurological activity is purposeful. "Diazepam?" Phillips said, but his tone was asking, not instructing. "If it generalizes. Right now I want a second set of eyes on his pupils. They're reacting now, which is right, but the left is not matching the right." Phillips leaned in with his pen light. He was quiet for a moment. "Left is sluggish," he said. "Something else is going on," Lena said. "This isn't just the toxin. He may have a head injury that got missed at scene. We need a CT, and we need neuro to be aware." Phillips was already moving. The next 20 minutes were organized chaos, which is the only kind of chaos a functional trauma bay produces. The soldier went to imaging. The other patients were managed, stabilized, reassessed. Lena moved between bays with the controlled economy of someone who had learned long ago that hurrying and efficiency were different things and that only one of them actually saved time. At 3:41 p.m., the bay doors opened and Dr. Doyle walked in. He had not been called. Someone had called him, probably not Sandra, who was too professional for that kind of move, but possibly one of the administrative staff who tracked physician presence and felt, on some level, that a second chemical casualty event in 4 days required senior oversight. He stood at the entrance to the bay and looked at it, looked at the patients, looked at Tomas, who was updating a medication log, looked at Phillips, who was on the phone with neurology. Then he looked at Lena. She was at the sink, washing her hands, and she saw him in the reflection from the glass panel above the basin. She dried her hands, turned around. "Nurse Carver," he said. "Dr. Doyle. You're assigned to the surgical floor." "I'm aware." "Then I'd like an explanation for your presence here." Tomas had stopped writing. The tech nearest the door had found something to be very busy with. The particular quality of silence that preceded something institutional settled over the bay. Lena looked at Doyle steadily. She had been awake since 5:30. She had spent 3 days managing dressing changes and IV infusions and listening to Gerald talk about beef stroganoff. And underneath all of it, she had been carrying something heavy that she didn't have words for, something that was not exactly anger and not exactly resignation, but lived in the same neighborhood as both. 4 soldiers came in with organophosphate toxidrome, she said. The attending had not yet arrived. The scanner caught the dispatch earlier than the official notification. She kept her voice level. I came down. You came down, Doyle said, despite being formally removed from trauma rotation. Yes. And you initiated treatment protocols you are not authorized to initiate. I provided clinical assessment and supported the attending physician who arrived within 1 minute of the first medication being administered. That's not… Dr. Doyle! Her voice didn't rise. It didn't need to. There is a soldier in the CT scanner right now who has a suspected subdural hematoma in addition to organophosphate poisoning. There are 2 soldiers in adjacent bays who were treated for bronchospasm from chemical exposure. There is 1 soldier with blast injuries who is stable. All 4 of them are alive. She paused. Is there something specific about that outcome you'd like to discuss? The silence stretched. Doyle looked at her with an expression that had shifted. Not softened, not conceded, but shifted into something more calculated, less reflexively territorial and more deliberately strategic, which was, she realized, actually the more dangerous version. My office, he said. After your shift. Whether that's on this floor or the floor you're assigned to, that's a conversation for later. He turned and walked out. Tomas let out a slow breath. You okay? I'm fine. She wasn't fully fine, but it was true enough. Where are we on the pralidoxime for Bay 4? They went back to work. At 5:20 p.m., Major Winslow called. Lena stepped into the corridor. I heard there was a second incident, Winslow said. Yes. Chemical exposure again? Consistent with organophosphate or nerve agent compound. Lower concentration than a battlefield agent, but similar mechanism. The patients responded to atropine and pralidoxime. A brief pause. You treated them? I assisted. I need you to understand something, Winslow said, and her voice had lost the careful professional calibration from their walk and was carrying something more direct. We have been working backward from Tuesday's incident. The supply chain we've been tracing, it runs through a procurement vendor called Kellard Medical Solutions. That vendor has an exclusive contract with Harmon Ridge that was approved 14 months ago. Lena was quiet. The person who approved that contract, Winslow said, and who has continued to authorize the quarterly renewals. We've confirmed it's a physician. Lena's eyes went to the closed door of the trauma bay she'd just come out of. How certain? Enough that I've got federal agents incoming tomorrow morning. I can't tell you more than that on this line. I understand. I need you in that hospital, Winslow said. Whatever he's trying to do with that complaint, push back. Don't let him move you out of that building. After she ended the call, Lena stood in the corridor for a moment. The afternoon light through the windows was going orange and thin, the way it did in Wyoming in early autumn when the angle dropped quickly and the warmth left the air before the light did. A physician, procurement contracts, a vendor she had never heard of, and a complaint filed within 2 hours of soldiers from a targeted convoy coming through her trauma bay. She had been approaching this as a professional conflict, a hierarchy problem, a man protecting his territory. She had been thinking too small. The CT results came back at 6:15 p.m. and confirmed what she had suspected, a small subdural collection on the left, likely from a direct blow at the scene, secondary to the primary chemical exposure. Neurosurgery was consulted. The decision was to manage conservatively and monitor. The soldier's name was Corporal Marcus Trent. He was 26, from a small town in Missouri, and according to the sergeant who had followed the case from bay to CT to monitored unit, he had been in the military for 4 years and had been scheduled to complete his service in 7 months. Lena knew this because the sergeant told her. He found her at the nurses' station at 6:40 p.m., not demanding anything this time, not positioning himself between her and the patient, just standing there with his hands loose at his sides. Callahan, he said, and then caught himself. Sorry. The name tag. Carver. Yes. I need to say something and I don't have a good way to say it. She looked at him and waited. Tuesday night. I blocked you from treating Ashby. Ashby wasn't the patient. He was standing behind you. I know. I mean, he stopped, started again. Delgado, the patient in Bay 3. He's recovering. I know. I talked to him. The sergeant, his name tape read Colton, shifted his weight slightly. I was wrong to block you. Lena looked at him for a moment. There was something genuine in the discomfort on his face that she had not expected, partly because authority figures who did not expect to be wrong rarely wore discomfort in a way you could read. You didn't know me, she said. Doesn't matter. It matters a little. She wasn't letting him off the hook, but she also wasn't going to pretend the situation had been simple. You had wounded soldiers and an unknown nurse claiming authority she wasn't supposed to have. The suspicion was reasonable. The outcome might have been different. It wasn't. Colton nodded. He was quiet for a moment. Who are you? He said. Actually, she held his gaze. I'm the nurse on shift. He looked at her for a long moment. Then he nodded once, slowly, and went back to the waiting room. Doyle's office meeting happened at 7:15 p.m. He had made her wait. She arrived at 7 and he didn't open the door until 7:15, which she understood was deliberate. She spent those 15 minutes in the corridor outside his office going through her phone and not thinking about the box in her closet. Inside, he had a printed document on his desk. She could see it was a formal written warning, the kind that preceded termination proceedings. I'm adding tonight's incident to the review, he said. Returning to the trauma bay after formal reassignment constitutes insubordination. I'm recommending immediate suspension pending termination review. On what grounds? Willful violation of administrative directives. Pattern of unauthorized clinical intervention. The patient survived. That's not, I know, not the point. She sat down, which she had not been invited to do. Dr. Doyle, I want to ask you something directly. He looked at her. Something moved briefly behind his eyes. Kellard Medical Solutions, she said. The room was very quiet. What about them? His voice was even, professionally even. The kind of even that takes practice. They're a vendor with an exclusive procurement contract here. I'm wondering if you're familiar with the quality control issues that have come up in their medical supply chain. Doyle looked at her steadily. That's a matter for administration. Of course, she stood. I'll let you get back to the paperwork. She left his office. In the corridor, she exhaled once. Her hands were steady. They were usually steady. She pulled out her phone and typed a message to Winslow's number. 3 words. He knows I know. The reply came back in 4 minutes. Tomorrow, 0800. Don't be alone. Lena pocketed her phone and went back to the floor to finish the last 40 minutes of her shift. At 8:02 p.m., as she was completing her final chart entries, Tomas appeared at her elbow. There's a woman asking for you at the front desk, he said. Not a patient, not family. She's got a badge I don't recognize. He paused. She said to tell you the convoy commander didn't make it to the hospital. Lena looked up from the chart. Which convoy? Tomas looked at her. She said you'd know which one. The chart entries blurred slightly at the edges. Lena blinked once, put down the pen, and walked toward the front desk. The woman at the front desk was not what Lena expected, though she wasn't sure what she had expected. Mid-50s, compact, wearing a dark jacket that had seen better days, with the kind of posture that doesn't come from a gym, but from years of carrying weight in the field. Her badge was clipped to her belt rather than hanging around her neck, which was a small thing that meant something. She looked at Lena the way people who have been in serious situations look at each other. A fast, complete assessment that covered more than the surface. Carver, she said. Not a question. Yes. Special Agent Diane Purcell, DCIS. She said it quietly, close, not for the benefit of the reception desk volunteers 3 feet away. Can we step outside? The air was cold now, properly cold, the kind of Wyoming autumn evening that arrived without transition. They walked to the edge of the ambulance bay, far enough from the entrance cameras that Lena noted it and understood that Purcell had clocked the camera positions before she arrived. The convoy commander, Lena said. What happened? Lieutenant Colonel Warren Hess. I was not in the convoy that came to you today. He was en route from Fort Braxton when his vehicle was run off Route 14 approximately 40 miles east of here. Purcell's voice was flat and precise. He's alive, barely. He's in surgery at Kramer County Hospital right now. The accident was not an accident. Lena absorbed that. Winslow told me federal agents were coming tomorrow. That was the plan before Hess's vehicle went off the road. Purcell looked at her steadily. We moved the timeline up. My team will be at Harmon Ridge at 0600. Doyle already knows something is moving. I said Kellard's name in his office an hour ago. Purcell didn't flinch, but something in her jaw tightened by a millimeter. You said the vendor name directly to him? I needed to see his reaction. And? He knew exactly what I was referencing. He controlled his response well, but not well enough. Purcell was quiet for a moment. He may try to move things tonight, documents, communication, people. Or he may try to move me, Lena said. What do you mean? The termination paperwork is already drafted. If he files it tonight rather than waiting for the review, I lose my access to this building. She looked back at the hospital entrance. I think that's been the objective all along. Get me far enough from this bay that I can't see what's coming through the door. Purcell studied her. Winslow said you had a background. Winslow talks too much. A sound that was almost but not quite a smile crossed Purcell's face. She said that too. She reached into her jacket. I need you to do something. If Doyle initiates any termination proceedings tonight, call this number. We can issue a temporary administrative hold through the U.S. Attorney's Office. It'll freeze any personnel actions against you for 72 hours pending investigation. It's not a guarantee, but it buys time. Lena took the card. She now had 2 of them in her pocket. What's in those supplies? She said. The ones from Kellard. What did they actually contain? Purcell looked at her for a long moment. We traced a shipment of purified organophosphate precursor compounds routed through a medical supply manifest as cleaning solution. 53 liters, delivered in 4 separate shipments over 6 months. Lena did the math without intending to. 53 liters of precursor, properly processed, could produce enough agent to affect a significant number of people. Not a mass casualty event on the scale of industrial sabotage, but more than enough to do what had already been done to 2 convoys on Highway 9. He's been building inventory, she said. That's our working theory. The 2 convoy attacks may have been field tests. Purcell held her gaze. We don't know if there's a larger target yet. That's what Hess was bringing us. He had documentation, physical records he'd pulled together from inside the unit that could establish the full scope of the operation. And now Hess is in surgery. And the documentation was not recovered from the vehicle. The ambulance bay was empty, and the cold had moved past Brisk into the range that made the fingers ache if you stayed still too long. Lena was not staying still. She was working through something, following a thread from Tuesday night through the complaint and the reassignment and the Kellard question in Doyle's office and forward into the shape of what the next 14 hours might look like. Go home, Purcell said. Get some sleep. Be back here at 05:30. You don't need me to eat. I need you functional. Go home. Lena went home. She did not sleep well. She lay in the dark for 2 hours and then stopped trying and sat in the kitchen with the light over the stove on and a cup of tea going cold beside her. She thought about the convoy commander in surgery at Kramer County. She thought about Corporal Trent, who had a small subdural collection and 7 months left in his service and was from Missouri. She thought about the box in the closet. At 4:15 a.m. she opened it. She had not opened it in 3 years, and the lid came up with the slight resistance of something that hasn't been moved, and inside it smelled like the past, canvas and something antiseptic, and the particular neutral scent of military-issue storage materials. There were no medals on top. She'd put those away separately, somewhere she didn't have to see them. What was on top was a folder, worn at the corners, containing the last set of operational documents she had been cleared to keep, unclassified portions of her separation packet, training records, a citation that used language so carefully bureaucratic it could have been describing a filing clerk. Underneath the folder was a photograph. Not many photographs. She had never been someone who documented things. But this one she had kept because of the faces in it. 7 people, desert backdrop, the particular squinting expression you get when the light is directly overhead and relentless. She was 3rd from the left. She looked younger, which she was, and harder, which she also was. And she was smiling in the way you smile when you've just come through something that could have ended differently. She looked at it for a while and then put it back. She did not take anything out of the box. She closed the lid and left it on the floor of the closet and got dressed and drove to Harmon Ridge an hour earlier than Purcell had asked. The hospital at 4:40 a.m. had the particular quality of institutions that never fully sleep. Not busy, not quiet, operating at the reduced register of overnight staff and the soft machinery of monitoring equipment. The night charge nurse, a man named Roland, who had worked overnights for 12 years and treated the early morning hours as his personal property, looked up from the station when Lena came through. "You're early," he said. "Couldn't sleep." He looked at her for a moment with the evaluative neutrality of someone who had seen enough night shifts to recognize when a person was carrying something. "Coffee's fresh. Actual fresh, not the second pot stuff." She poured a cup and sat at the far end of the nurse's station and opened the chart system on the terminal. She was not looking for anything specific. She was doing what she had done on the surgical floor for 3 days. The kind of looking that doesn't have a specific target, that covers terrain, that catalogs things that are present and notes things that are absent. What she noticed at 5:07 a.m. was a procurement access log she had no particular reason to be looking at, in a directory she had navigated to through 3 menus of administrative records, in a section of the hospital's internal system that was accessible to clinical staff but rarely visited by them. Kellard Medical Solutions. 4 orders in the last 18 months. Documented as miscellaneous laboratory supply. Authorized signature, R. Doyle, MD, Trauma Director. She photographed the screen with her phone. Then she photographed the adjacent entries, which showed 3 orders from a legitimate supply company cross-referenced against the same delivery dates, which meant the Kellard shipments had been logged in tandem with legitimate orders, buried in the data rather than standing alone, which was either careful administrative practice or a specific attempt to make the trail harder to read. At 5:24 a.m., her phone buzzed. The message was from a number she didn't recognize, which by itself was not unusual. Clinical staff sometimes texted from personal numbers, but the message was not clinical. "You should have stayed upstairs. Last chance." She stared at it for a moment. Then she forwarded it to Purcell's number with a timestamp and screenshot, put her phone face down on the desk, and finished her coffee. Roland appeared at her elbow at 5:31. "Someone's looking for you." She looked up. Sergeant Colton was standing at the end of the corridor. Not in uniform this time, civilian clothes, jeans, and a jacket, which meant he was not here in any official capacity, which meant he had come on his own. She met him halfway. "I need to tell you something," he said, "and I need you to understand I am not here because anyone sent me. Okay? I've been talking to the guys from both convoys, the ones well enough to talk." He glanced down the corridor. The route for Tuesday's convoy was not the scheduled route. It was changed 12 hours before departure. The new route came down through a logistics update that someone fed into the system. Officially, it looked like a traffic and road conditions advisory. Someone changed their route to put them on Highway 9. Both convoys. Both times. His voice was quiet and controlled, and underneath the control was something that Lena recognized as a man working hard not to be as angry as he actually was. Whoever set those devices knew exactly where the vehicles were going to be. "Route information," Lena said. "Who would have access to military convoy logistics from inside a hospital?" Colton looked at her. "That's the question." It was the question. A physician with procurement contracts and a vendor relationship could obtain supplies. But convoy route information was a separate chain entirely, which meant either the network was larger than one person, or the person at the center of it had access to something she hadn't accounted for yet, or they had help from inside the military itself. She did not say that out loud. "Thank you," she said to Colton. "Is there anything I can—" "Go back to your people. Check on Trent. Let the people who are handling this do their work." He nodded. He looked like he wanted to say something else and decided against it. She respected that. Purcell arrived at 6:03 a.m. with 2 other agents and a woman in a different kind of suit. Federal prosecutor, Lena guessed from the briefcase and the way she looked at the building like it was a problem to be solved. They went to the administrative conference room on the 2nd floor. Purcell's team set up quickly and without ceremony, and the prosecutor, who introduced herself as Lena had expected, Assistant U.S. Attorney Margot Fielding, put a laptop open on the table and pulled up a document that was dense with columns of figures. "We have the procurement records," Fielding said. "We have chain of custody documentation on the Kellard shipments. We have preliminary forensic analysis connecting the chemical compounds found at both convoy sites to materials matching the Kellard supply manifest." She looked at Lena. What we don't have yet is the route modification documentation. That's military side, and that access requires a different set of warrants. What do you have enough for right now? Lena asked. Enough to bring him in for questioning, not yet enough for a sealed indictment. Fielding looked at Purcell. We need the physical records from Hess, or we need something equivalent. Hess is still in surgery, Purcell said. I know. The room was quiet for a moment. He uploaded copies, Lena said. Everyone looked at her. Before he left Fort Braxton. If he was carrying physical records in a vehicle that was being run off roads, he would have uploaded copies. That's basic operational security. Purcell looked at her with an expression that was measuring something. Where? That I can't tell you. But if he had someone on the inside of the investigation he trusted, someone who was expecting him to arrive with that documentation, he would have sent copies ahead as backup. Purcell pulled out her phone and stepped to the corner of the room. The conversation was brief. When she came back, her expression had shifted. He sent an encrypted file package to Winslow's secure server at 13:47 yesterday afternoon. Fielding's jaw tightened, but it was the tight jaw of someone absorbing good news under pressure. Can we access it? Winslow's en route, ETA 40 minutes. The next 40 minutes were not quiet. Purcell's team was moving through documentation, cross-referencing purchase orders, flagging a pattern in the Kellard invoices that showed systematic over-ordering of specific supply categories in quantities that exceeded anything Harmon Ridge's patient volume could justify. Lena sat at the far end of the table and looked at the pattern and thought about timing. Doyle had filed the complaint 2 hours after the first convoy came through. The termination paperwork had been drafted by the end of business day after the second. The threatening text had arrived at 5:24 a.m. before Purcell's team was in the building, which meant either Doyle had surveillance on the hospital's entry points or he had a source inside who had seen her arrive early. She thought about Roland at the nurse's station. She didn't want to think that, but she thought it anyway, because excluding possibilities because you liked a person was how you missed things. She pulled up the administrative access log on her phone. She had photographed the procurement entries and looked at the timestamps on the Kellard orders again. 4 orders. The first had been placed 14 months ago, coinciding with the contract approval. The second, 8 months ago. The third, 5 months ago. The fourth, 6 weeks ago. She stared at the 6-week figure. 6 weeks ago, she had filed a report about missing supplies from the Trauma Bay inventory. A routine discrepancy report. 3 items short on a monthly count, nothing dramatic. The kind of report that got filed and reviewed and occasionally resulted in a stern reminder about inventory protocol. She had never received a response to that report. She pulled up the file on her phone. She had kept a copy, again a habit that she could not fully account for, except that she had spent years in environments where keeping copies was the difference between having a record and having nothing, and looked at the items flagged as missing. Sterile irrigation solution, 5-liter bags, 3 units, oxygen tubing, 2 boxes, and 1 item she had flagged with a question mark because she wasn't certain it was actually missing or simply miscategorized. A shipment of laboratory-grade buffered solution that had appeared on the receiving log but was not present in the storage inventory. Laboratory-grade buffered solution. She looked at the Kellard manifest that Purcell's team had on the table. She stood up and walked to the table and pointed at the 4th Kellard order. What's listed in this shipment? One of the agents, a younger man named Torres, looked at the document. Miscellaneous lab solution, category 4B, delivered to the loading dock, signed for by facilities. Who in facilities signed? Torres ran his finger down the page. D. Price. Is that name in any other Kellard delivery records? Torres looked again. No. The other 3 deliveries were signed by different facilities staff. One person, Lena said, received one specific delivery 6 weeks ago, different from the pattern on the other 3. She looked at Purcell. And 6 weeks ago is when a discrepancy appeared in our lab solution inventory that was never resolved. Purcell leaned over the table and looked at the document. Where do I find D. Price? Facilities management, day shift, probably in around 7. It was 6:49 a.m. Winslow arrived at 6:54 in road clothes, which meant she had driven, not flown, and the drive from Fort Braxton to Dunmore Falls was 4 hours, which meant she had left at approximately 3 in the morning, which meant she had known something was accelerating before Purcell had called her. She walked into the conference room and looked at Lena. You held your ground, she said. Barely. Barely counts. Winslow sat down and opened her laptop. The encrypted file package from Hess loaded slowly, in the way that heavily encrypted things do, and while it loaded, Winslow looked at the procurement documents on the table, and her expression did something that Lena could only describe as settling. The look of someone who has been tracking a shape in the dark and is now seeing it in full light. The file opened. There were 47 documents in the package. Winslow scanned them rapidly, with the practiced speed of someone who knew what she was looking for, and then stopped on one and turned the laptop. It was a communication log, military email system, internal, with a routing address that went through a Fort Braxton logistics server. The content was a series of brief exchanges over a 3-month period discussing route updates, advisory flags, and what appeared on the surface to be standard convoy logistics coordination. The send address on the military side was a logistics staff account. The receiving address on the other end was a personal email account with a domain that meant nothing until Lena looked at it for 3 seconds and then recognized the domain as matching a string in the Kellard Company registration documents she had seen on Torres's screen. Kellard Medical Solutions had a contact address that shared a domain with the personal email receiving convoy route modifications. The same person, Lena said quietly. Or someone they controlled, Winslow said. Inside Fort Braxton. Yes. Fielding was already on her phone. The room shifted in the way rooms shift when a critical mass of evidence clicks into place. Not louder, not more urgent in any visible way, but with a changed quality of attention. Everyone was moving on a different internal clock now, the clock of something that was becoming irreversible. At 7:12 a.m., Purcell's phone rang. She answered it, listened for 12 seconds, and looked at Lena. Doyle came in early, she said. He's in his office, and he's shredding. Lena was out the door before the sentence was finished. There was 40 seconds she didn't have. The stairwell was cold, and the fluorescent light was the sickly morning kind, and her shoes were loud on the metal treads, and she was aware that she was running toward something that she should technically be leaving to the agents behind her. But the agents behind her were 40 feet back, and whatever Doyle was destroying was disappearing by the second. She hit the corridor at a pace that was not quite running, moving fast enough that a supply tech flattened himself against the wall, and she reached Doyle's office door and tried the handle. Locked. She knocked. Not politely. Dr. Doyle. Nothing. She knocked again, harder. Dr. Doyle, I need to speak with you. Inside, she heard something. The particular sound of a paper shredder, which confirmed what Purcell had been told, and also the sound of a drawer closing, and then a pause, and then movement. The lock clicked. Doyle opened the door. He was in his coat, which meant he had either just arrived or was planning to leave quickly, and he was holding himself with the particular stillness of someone who has made a decision about how to play the next 5 minutes. Nurse Carver, he said, I don't have an appointment with you. She stepped forward. He did not step back, which meant she was close enough to see what was on his desk. Papers, yes, but not just papers. A hard drive, disconnected, sitting beside his keyboard. And behind him, the shredder's feed tray held the corner of what had been a multi-page document. Those federal agents down the hall, she said, are going to want to see everything in this office exactly as it is right now. Something moved through his face. Fast. Gone. I don't know what you're talking about. Raymond. She used his first name deliberately, and she watched it land. You filed that complaint because I was in that trauma bay when your convoy came through. You needed me out of the building before the second incident, and when that didn't work, you tried to terminate me last night. And when that didn't work either, you came in at... She glanced at his desk clock. 7 in the morning to shred documents and pull the hard drive. She kept her voice level. You've been thorough. You've been careful. But thorough and careful have a limit. His expression had gone very still. And then, from the corridor behind her, she heard footsteps. More than one person, moving with purpose. And Purcell's voice. Dr. Doyle, my name is Special Agent Purcell, Defense Criminal Investigative Service. Please step away from the desk. Doyle looked at Lena for one more second. She had expected something in his face. Guilt or fear, or the particular look of a man calculating whether there was still a move left. What she saw instead was something colder, more deliberate. The expression of a person who had already decided what they were and had stopped being surprised by the consequences of it. He stepped aside. The agents moved past Lena into the office, and Torres went directly to the desk and put his hand over the hard drive before Doyle could touch it. Fielding appeared in the doorway. She looked at the shredder, looked at the hard drive, looked at Doyle. "Dr. Doyle, you are being detained for questioning in connection with a federal investigation. You are not under arrest at this time, but you do not have to answer questions, and you have the right to an attorney before any questioning begins." The hospital corridor was very quiet. 3 nurses at the far end of the hallway had stopped moving. The supply tech from the stairwell had appeared from somewhere and was standing very still near the elevators. Doyle said nothing. His attorney's name came out of his mouth in one flat sentence, and then he went silent and stayed silent. Lena stepped back. She was in the corridor as they let him out, and she watched it happen with the particular feeling of something that was not satisfaction, but was adjacent to it. Not warm, not triumphant, but real, and grounded, and long overdue. And then she heard it. From the end of the corridor, from the direction of the trauma bay, the trauma activation alarm, the specific tone and rhythm that meant incoming critical, and underneath it, immediately after, the overhead page. Trauma team to bay 1. Trauma team to bay 1. She turned. Sandra was already at the head of the corridor, moving fast, and when she saw Lena, she did not slow down, but she called out as she passed, "Military, it's the convoy commander. They're bringing him here, transferred out of Kramer County 20 minutes ago. He's crashing, Lena. They say he's crashing." Winslow appeared at the conference room door, her face taut. "Hess," she said, "he didn't stabilize. They're transferring him here because Kramer County doesn't have the capability." Lena was already moving. Behind her, in Doyle's office, the federal agents were logging evidence. Ahead of her, the trauma bay doors were opening for a gurney carrying the only man who had documentation that connected everything. The man whose vehicle had been deliberately run off a mountain road. The man who had kept enough of himself together to upload an encrypted file package before he drove into whatever had been waiting for him on Route 14. She went through the doors. The gurney came in hard, paramedics on both sides at a run, and the man on it was gray in the way the soldier in Bay 3 had been gray, but worse, older, more total, the gray of a body that has been through surgery and sustained trauma and has been fighting for 12 hours and is running low on whatever reserve it had been drawing from. His pressure was 61 over palp. His chest was moving but wrong. And the paramedic on the left looked at Lena as they transferred to the bay bed and said, words tumbling fast. "Post-op rebleed. The surgical site didn't hold. He's been in and out since transfer. And there's something else. About 10 minutes out, he started showing symptoms we don't understand. Lacrimation. Secretions starting." Lena looked at the man on the bed, looked at his eyes, and went very still inside in the way she went still when she understood something she did not want to understand. She leaned close, quickly, and opened his left eyelid. Pinpoint pupils. In a man who had been in surgery. In a man who had not been at the convoy sites. In a man who had been under medical supervision since his vehicle went off the road. She straightened. "Who had access to him at Kramer County?" she said. Her voice was level and very quiet. "In the last 4 hours, who was in his room?" The paramedic looked at her. We just transported. Get me Kramer County's charge nurse on the phone right now." She was already gloved. "And get Winslow in here." Because what she was looking at was not surgical rebleed. What she was looking at was a man who had been poisoned in his hospital bed. Winslow came through the trauma bay doors 40 seconds after Lena called for her, and she took one look at the man on the bed, and her face did something that Lena had not seen it do before. It went uncertain, which on Winslow's face was the equivalent of alarm on anyone else's. "What are we looking at?" "Cholinergic toxidrome. Onset approximately 10 minutes before transfer, based on the paramedic's account." Lena was already drawing atropine. "Someone had access to him at Kramer County. He was in a secure pinpoint pupils, lacrimation, secretions building. He was post-surgical and monitored, and someone still got to him." She looked up briefly. "Get Purcell." Winslow was on her phone before she finished the sentence. "Doctor." Phillips arrived 60 seconds later, slightly out of breath, taking the handoff from Lena in the same shorthand they had developed over the last 3 days. Not friendship exactly, but the functional fluency of 2 people who had worked under pressure together enough times to stop explaining the obvious. "Post-op transfer, rebleed plus secondary poisoning," Lena said. "BP 61 over PAL, pulse 48, pupils pinpoint and fixed, secretions increasing. Atropine 2 milligrams drawn. Chest sounds diminished bilaterally. I don't know yet if that's aspiration risk or early pulmonary involvement. Give the atropine, Phillips said, pulling on gloves, and get me a pressure line. I need something better than a cuff reading. Tomas, Lena said. Tomas was already moving. The atropine went in at 7:31 a.m. Lena watched the clock and the monitor simultaneously, the way she had done in places where the clock was the only thing she could control. Heart rate at 48. Secretions audible. The ventilatory effort was there but labored. Not yet critical, but moving in that direction faster than she wanted. His pressure's not responding, Phillips said at the 2-minute mark. We're competing with the surgical bleed, Lena said. He needs a second intervention for that. Where's surgery? Paged. Page them again. Phillips looked at her. Not challenging, just the brief eye contact of someone checking alignment. Then he paged surgery again. The atropine began to register at 3 minutes and 20 seconds. Not dramatically, not the clean response she had seen in the soldiers 2 days ago, but a gradual shift in the secretion level and a heart rate that ticked from 48 to 53 to 57 over the next 4 minutes. The blood pressure was harder. It came up marginally, 69/42, and then stalled there, which told her the bleed was still active and the fluid losses were working against every intervention they made. He needs the OR, she said. Surgery's 40 minutes out, Phillips said, and his voice had the particular flatness of a physician delivering a time estimate that is insufficient and knows it. Then whoever's available in this building needs to be in this bay in the next 10 minutes. Winslow reappeared at the door. Purcell's team is running the Kramer County chain of custody. Someone accessed Hess's room at EO 510 this morning under a false nursing credential. They're pulling camera footage. Who authorized the transfer? Lena asked, not looking up from the patient. The transfer order came through Kramer County's attending, standard post-surgical deterioration protocol. Nothing on paper that looked irregular. Someone created a deterioration to justify the transfer. They poisoned him to produce symptoms consistent with surgical complications so he'd be moved. She was adjusting the IV rate, watching the pressure numbers. And if he'd come here and crashed before anyone understood what they were treating, he'd be dead, and it would look like surgical failure, Winslow finished. The room was quiet except for the monitors. Lena thought about that for 3 seconds and then stopped thinking about it because she needed to think about the patient in front of her, who was not dead yet, and who had 47 documents worth of evidence in an encrypted file on Winslow's server, and who she was going to keep alive long enough for that to matter. Get me a second large-bore IV and more atropine. And someone call the blood bank. I want 2 units of O negative on standby. The surgeon who answered the page was not the chief. She was a general surgeon named Dr. Avani Mehta, 5 years out of residency, who had been in the building early for an elective case that hadn't started yet, and who walked into the trauma bay at 7:44 a.m. with the expression of someone who had been told one thing on the phone and was now looking at something significantly different. She did a fast assessment. She looked at the monitors. She looked at the OR schedule board, which was visible from the bay doorway. She looked at Lena. You're the nurse they've been talking about, Mehta said. I need you focused on the patient. Mehta turned back to the patient. She had that quality, the ability to be redirected without ego injury, which was rarer than it should have been. She reviewed the imaging Phillips had pulled up on the bay monitor, the CT from Kramer County showing the post-surgical field and the re-bleed, and she ran her finger along the relevant anatomy without touching the screen. He needs to go back to the OR, she said. The bleeding is at the primary surgical site. It's accessible, but his pressure is going to make anesthesia complicated. His pressure is complicated because he's been poisoned, Lena said. We're managing the toxidrome in parallel. The question is sequencing. Mehta was quiet for a moment. You're saying if we manage the pressure better, the anesthetic risk drops. I'm saying the two problems are feeding each other. The bleed is limiting our ability to raise his pressure. His low pressure is limiting his perfusion and making the toxidrome presentation worse. If we can get him to OR and repair the bleed, we remove one variable. The toxidrome doesn't go away in OR. No, but we can manage it there as well as here, and at least we're removing the blood loss from the equation. Mehta looked at Phillips. Phillips looked at Lena. It was a very brief triangle of eye contact. Get him ready to move, Mehta said. The next 18 minutes were not fast enough and not slow enough. They were the exact speed of an intervention that is racing a deterioration and not comfortably ahead. Lena pushed a second dose of atropine at the 8-minute mark. When the secretions began increasing again, monitored the pressure, watched the rate of the IV fluids, and talked to Hess. He was not consistently conscious, but there were moments, brief, fragmented, when his eyes focused and something purposeful moved behind them. At the 12-minute mark, one of those moments happened. Lena was adjusting his oxygen mask, and she was close to his face, and his eyes opened and actually tracked to her, and she said quietly, "You're at Harmon Ridge. We're taking care of you. The documents are secure." His mouth moved. She couldn't hear it. She leaned closer. "Price," he said, or something that sounded like Price. His voice was barely sound, air shaped into the approximation of a word. "D. Price," she said. "We know. We're looking at it." His eyes stayed on her for another 3 seconds, and then the focus went out of them again like a light dimming, not unconscious, but retreating back somewhere internal, and she straightened and went back to managing the IV and the monitors and the clock. They moved him to OR at 7:59 a.m. The trauma bay was quieter without him in it. The monitors went to standby. Tomas began breaking down the setup with the efficient thoroughness of a man who used physical tasks to process things that were hard to sit with, and Lena stripped her gloves and stood at the sink and ran water over her hands longer than she needed to. Purcell appeared in the doorway. "Footage came through from Kramer County," she said. 0510 this morning, a male individual in scrubs accessed the ICU using a staff badge registered to a nurse who was on approved leave. The badge was cloned. She paused. "The individual matches the physical description of D. Price. Facilities manager, Harmon Ridge." Lena turned off the water. "Price is still in the building?" "Day shift started at 7. He badged in at 6:52. Purcell's expression was controlled. "We have agents on him. We're watching, not moving yet. We want to see who he contacts. He's going to know Doyle is in custody by now. Word travels in this building in under an hour." "I know. We're giving it another 15 minutes. Lena dried her hands. "The convoy route modifications. Price had access to the supply deliveries, but the route information came from inside Fort Braxton. You're looking at 2 separate sources. We're aware Winslow's team is working the Fort Braxton side. There's a logistics warrant in process." Purcell's phone buzzed. She looked at it. "Price just made a call from the facilities office. 32 seconds. Unregistered number. Move him now," Lena said. "That's my call." "I know it is." A beat. Purcell stepped out into the corridor, spoke into her radio quietly, and came back. "They're picking him up. But the facilities office was in the basement level, past the loading dock and the central supply storage, in the part of the hospital that existed below the threshold of patient care, the unglamorous infrastructure of a building that ran 24 hours a day and required constant physical maintenance to do so. Lena had been down there twice in 3 years, both times to track down equipment that had been sent for maintenance and not returned. She was not supposed to follow Purcell down there. She was a nurse on shift, currently assigned to the surgical floor technically, and still under administrative review. And the correct thing to do was go upstairs and manage patients and let the federal agents manage the federal investigation. She went to the surgical floor. She checked in with the charge nurse. She managed patients for 47 minutes. She was professional and efficient, and her hands were steady, and she did not think about the OR 2 floors up, where Mehta was working on a man who had been poisoned in his hospital bed. At 9:02 a.m., Winslow appeared on the surgical floor. "Walk with me," she said. They walked. "Price talked," Winslow said, "faster than we expected. He had a lawyer on the phone before Purcell finished reading him in, and then he called Purcell back 20 minutes later and said he wanted to cooperate." "What did he give them?" "The full supply chain. He was the receiving end at Harmon Ridge. He accepted the Kellard deliveries, logged them under legitimate inventory categories, and moved the materials to a secondary storage location that was not on the standard facility map. He has been doing this for 11 months. Winslow paused. "He also gave us the name of his Fort Braxton contact." Lena waited. "Staff Sergeant Patricia Knoll, Logistics Division." She's been feeding convoy route modifications through the advisory system for 7 months. She was recruited by Doyle through a third party. They've never met directly. "Does Knoll know Price is talking?" "Not yet. She will within the hour. Braxton MPs are moving. The corridor they were walking was the connection between the main building and the east wing, glass on one side overlooking the hospital's small courtyard, which had a bench and 3 trees that nobody ever sat near in November. The light through the glass was thin and white. "Hess," Lena said, "still in OR." "How long?" Meta said 2 hours minimum. No updates yet. Lena nodded. "There's something else," Winslow said. She had a quality to her voice that Lena had not heard before. Not hesitation, but something deliberate, the way you speak when you are choosing words because the words matter. "The classified portion of your service record. It was accessed." Lena stopped walking. "When?" 9 days ago, before the first convoy. The access request came through a records query that was routed to the appropriate classification authority, and it was approved because the requesting party had an institutional credential that gave them legitimate access to personnel records. Doyle? No. The credential belonged to the hospital's legal department, a consultant who handles military liaison work for veteran employees. Her name is Suzanne Park. She had access to the HR system and through that to the military personnel database for verification purposes. Winslow looked at her steadily. "She's not a suspect. Her credential was used without her knowledge. The access was piggybacked on her institutional login." Lena understood what that meant. Someone had known, before the first convoy came through, that Lena was at Harmon Ridge, had looked up who she was, had confirmed what was in her record, and then the convoy came through and she was in the trauma bay and she handled it the way she handled it, and Doyle filed a complaint 2 hours later. "He pulled my record," she said, "before the convoy. He already knew." "It appears so." "Which means he was worried about me specifically, not just a nurse who overstepped. Me. Your chemical casualty training is specifically noted in your service record. If he was planning an organophosphate attack and he found out there was someone in his trauma bay who had specialized training in exactly that casualty type, he needed to move me before it happened." She said it quietly, not for effect, just because it was the accurate conclusion. "The complaint wasn't professional. It was strategic. He needed me off that floor before his test convoy came through." Winslow looked at her. "That's what we think," she said. Lena stood in the glass corridor with the white November light coming through, and she thought about 3 days on a surgical floor changing dressings and listening to Gerald talk about his late wife, and about the threatening text at 5:24 a.m., and about a termination packet sitting in a file somewhere with her name on it. "Is the review still pending?" she asked. "Purcell contacted hospital administration this morning. The review has been suspended pending investigation. Pam Whitfield, nursing director, was informed of the federal involvement at approximately 0800. Winslow paused. "She asked for your personnel file. Good or bad?" "I don't know yet." At 10:17 a.m., Purcell called a meeting in the administrative conference room that included Winslow, Torres, Fielding, 2 additional DCIS agents who had arrived while Lena was on the surgical floor, and the hospital's CEO, a man named Garrett Pulaski, who had the particular expression of someone whose Tuesday morning had departed completely from anything he had planned for. Lena was in the meeting because Purcell had asked her to be. She sat at the far end of the table and said very little and listened to the accounting of what the investigation had established over the preceding 4 hours, which was extensive. The Kellard supply chain, the precursor compounds, the delivery records and Price's cooperation, and the Fort Braxton logistics thread, and Staff Sergeant Knoll, and the convoy route modifications. Doyle's personal email account, accessed with a warrant issued at 9:40 a.m., had produced 42 months of communication with a network that Fielding described as small, targeted, and financially motivated. Not ideological, not political, but transactional. People who had been paid to move materials and look the other way. Doyle himself had not spoken. He had his attorney, and he was using that attorney, which was his right. And Purcell was clear-eyed about the fact that a man like Doyle would be defended expensively, and the case needed to be built without relying on his cooperation. The case was being built. Pulaski asked 3 questions throughout the meeting, all of which were about institutional liability, which was the appropriate thing for a CEO to be concerned about, and which Fielding handled with the particular patience of someone who had sat across from hospital administrators before. At the end of the meeting, Pulaski looked at Lena. "The administrative review against you," he said. I'm told it was opened at Dr. Doyle's specific recommendation. That's correct. And the clinical actions that prompted the review, treating patients without physician authorization. The physicians were not present when I acted. In both instances, they arrived within minutes and confirmed and continued the treatment protocols I had initiated. She kept her voice neutral. The patients survived. Pulaski was quiet for a moment. The review is closed, he said. It was not an apology. It was not a recognition. It was an administrative statement delivered in a conference room with federal agents present, and it was the minimum, and she knew it was the minimum, and she also knew that it was, at that moment, more than she had expected from this building. Thank you, she said. The OR called at 11:38 a.m. Mehta's voice on the phone was tired but contained. He's out. The repair held. He's going to ICU, and he's going to be there for a while, but he's out. Lena took the call at the nurse's station on the surgical floor, and when it was done, she sat for a moment with the phone in her hand. Tomas appeared beside her. Hess? Out of surgery. Tomas let out a breath that said several things without any words. She went back to her patients. At 2:15 p.m., Winslow came to the surgical floor for the third time that day. Noel is in custody at Fort Braxton, she said. She had a second contact we hadn't identified, a civilian contractor who handled the actual device construction. He's been taken into custody in Casper. She paused. The device components matched the Kellard inventory exactly. Forensic confirmation. Purcell says the chain is complete from procurement to detonation. What about Doyle's financials? Preliminary look shows 3 offshore transfers totaling approximately $2.4 million over 22 months. The money came from an entity that connects to a defense procurement fraud scheme that DCIS has been running a separate investigation on for 8 months. Doyle was a supplier to a larger network. He wasn't the center of it. Lena absorbed that. A larger network meant this was going to be bigger, longer, more complicated than what she could see from inside one hospital in Dunmore Falls. That was not her territory to manage. She noted it and let it go. He's going to try to make a deal, she said. Almost certainly. Will it work? Fielding says the evidence is strong enough that whatever he offers, they can probably establish it independently. His value as a cooperator is limited. Winslow looked at her. He's not getting out of this. The afternoon moved. Lena worked. She managed a post-surgical patient who was anxious about going home and spent 20 minutes explaining the discharge instructions in a way that took the fear out of the process without minimizing the recovery ahead. She caught a medication error in a transcription. Not dramatic, not life-threatening, but a real error that would have produced a real problem. And corrected it and documented it the way you were supposed to and moved on. At 4:30 p.m., Gerald from room 214 asked her if she'd figured out the beef stroganoff yet. Not yet, she told him. I'll write down the recipe, he said. Eleanor's recipe. You should have it. I'd like that, she said, and meant it. At 5:50 p.m., Pam Whitfield appeared at the surgical floor nursing station. The director of nursing was a woman in her mid-50s who wore practical shoes and kept her office organized in a way that suggested she was genuinely on top of her workload rather than performing organization for an audience. Lena had met her twice, once at orientation 3 years ago, and once when Whitfield had done a floor walkthrough and stopped to ask about a patient acuity issue. She was not someone who appeared on the floor without a reason. She stood at the station and looked at Lena. Can I speak with you? They went to the small family consultation room at the end of the hall. Whitfield closed the door and sat across from her and put a folder on the table between them. I've reviewed your personnel file, she said. The full file, including the records that Dr. Doyle accessed as part of the complaint process. She paused. I want to be direct with you. Please. The complaint was not valid. The clinical actions you took were consistent with what any reasonably trained emergency nurse would have done in the same circumstances. A critical patient, no physician present, and a clear life threat. The fact that those actions also happen to be outside your technical assignment is a procedural issue that the circumstances mitigate substantially. She looked at Lena. What I should have done when that complaint crossed my desk was ask more questions before acting on it. Lena was quiet. I didn't, Whitfield said. I followed the chain of command and I moved you, and I shouldn't have done that without more scrutiny. I'm telling you that directly. I appreciate that. I also want to know whether you want to come back to the ER. Lena looked at the table for a moment. Outside the consultation room, the floor was running its late afternoon business. Shift change approaching, the particular rising energy of outgoing nurses, finishing documentation and incoming staff getting oriented. "I'll think about it," she said. Whitfield nodded, not surprised, not pushed. "Take the time you need." She stood. "The staff on the ER, Sandra in particular, have been asking about you. I wanted you to know that." She left the folder on the table. Inside was Lena's personnel file with the administrative review documents clipped to the top, and across the review documents in red ink someone had stamped, "Withdrawn, no further action." Lena looked at it. She closed the folder. She left the consultation room and went back to her patients. At 7:14 p.m., as the evening shift was taking over and Lena was finishing her last chart entries, Purcell appeared at the end of the corridor. She walked toward Lena with the particular efficiency of someone who has been moving fast all day and has one more stop to make. "I need to tell you something," she said. "Something that wasn't in the briefing this morning." Lena waited. "The supply inventory discrepancy you flagged 6 weeks ago. The one that went unacknowledged." Purcell looked at her directly. "It went unacknowledged because Doyle received it. It was routed to him as department head for review. He buried it. But before he buried it, he flagged it to Price. We found the email." She paused. "Your report is what accelerated their timeline. They were originally planning to run a third test. Your inventory report told them their supply chain had been noticed by someone inside the hospital, and they moved the larger operation forward." Lena looked at her. "The second convoy attack," she said slowly. "They moved it up because of my report." "Yes." She let that sit for a moment. It was a complicated thing to sit with, not guilt exactly, because she had done the right thing and it had been processed wrongly by people who were deliberately mishandling it, but something with weight in it nonetheless. And if they hadn't moved it up? If they'd completed the test phase and moved to the larger operation, Purcell chose her words carefully. Hess estimated, based on the inventory, that the full deployment could have targeted a base-adjacent civilian area. Casualty numbers in the hundreds. The corridor was quiet. Lena thought about a supply discrepancy report she had filed because 3 items were short on a monthly count, and a lab solution batch didn't match its receiving documentation. A routine report, the kind she had filed twice before in 3 years and had thought almost nothing of. "The report mattered," she said. "The report changed the timeline," Purcell said, "which put the test attack in front of you, which meant you were in the trauma bay when the patients came through, which meant you identified the chemical exposure for what it was." She paused. "If you hadn't filed that report, they would have been better prepared. And if you hadn't been in that bay, someone would have treated them. Maybe, but not the way you did, and not fast enough to see what you saw." Lena looked at the corridor and at the shift change happening around her, and at the quiet machinery of a hospital doing what hospitals did at the end of a day. Not triumphant, not simple, just ongoing. "Thank you for telling me," she said. Purcell nodded and started to move away, and then stopped. "Doyle's attorney contacted the U.S. Attorney's Office at 5 o'clock, she said without turning around. "He's offering full cooperation in exchange for a sentencing recommendation." "What does he have to offer?" Purcell turned slightly. "He has names, the larger network. The defense procurement scheme DCIS has been running. He says he can give us 6 additional individuals." She paused. "Fielding is going to evaluate what he actually knows before she commits to anything." "But he's talking." "He's talking." Lena finished her final chart entry. She signed out to the oncoming nurse, gave a complete handoff, and walked toward the elevator. She was at the elevator doors when her phone buzzed. The message was from a number she did not recognize, but the text was brief and the name at the bottom was not a name she had expected to see on her phone screen. "This is Marcus Trent, Corporal. Bay 4. They told me what you did. I wanted to say it before. I kept trying to say it, and they kept telling me to rest. I just wanted to say thank you." She stood at the elevator with the phone in her hand and the message on the screen and the end of a very long day pressing in on all sides. She typed back, "Rest. That's an order." She put her phone away. The elevator doors opened. She was stepping in when her phone buzzed again. Not Trent this time, a different number, one she recognized as the Kramer County Hospital's main line, and the call was short, 15 seconds. And when she lowered the phone, her hand was not fully steady for the first time in 4 days. Because the voice on the call had not been a nurse or an administrator. The voice had been Hess. Hoarse, barely there, the voice of a man 2 hours out of his second surgery, but unmistakably alert and unmistakably deliberate. He had said, "There's a name Doyle gave them that you need to know about. The person at the top of the network. It's not someone in logistics. It's not someone at Fort Braxton." A pause, the effort of speaking audible. "It's someone in this hospital, someone who hasn't been looked at yet, and they know we're coming." The elevator doors closed in front of her, and she stood in the empty car and looked at her phone and called Purcell. It rang twice. "Carver. Hess just called me from Kramer County." She kept her voice low and even. "He says Doyle gave up a name. Someone inside this hospital, someone at the top of the network who hasn't been identified yet." A silence that lasted exactly 3 seconds. "Where are you right now?" "Elevator, main building." "Don't go to your car, go back to the second floor conference room and stay there until I reach you. Do not talk to anyone." The call ended. She pressed 2 on the panel. The conference room was empty when she arrived. Agents had packed up the bulk of their materials during the afternoon, and the table held only the residue of a long day's work, paper coffee cups and a legal pad with handwriting she couldn't read upside down. She sat down. She did not turn the lights on fully. The room had a window that faced the interior courtyard, and the light from the courtyard lamps came through in thin yellow bars, and she sat in that and waited. Her mind was running the list, not anxiously, methodically, the way she had been trained to assess a situation when the parameters shifted. Who had been in the building with full administrative access and enough institutional positioning to move things above Doyle's level. Doyle was the executor. He had managed procurement, managed the supply chain, managed the personnel action against her. But procurement fraud at that scale, routed through a defense contracting network involving multiple parties across state lines, did not originate with a trauma director. Someone with broader authority had been the architecture. She thought about Pulaski, the CEO, and dismissed it within 4 seconds. Not because she liked him, but because the liability-focused questions he'd asked in the morning briefing were consistent with someone encountering the situation for the first time, not someone who had been managing it. She thought about the legal department, the consultant, Suzanne Park, whose credential had been used to access Lena's classified personnel file. Winslow had said Park wasn't a suspect, but someone had used her login. She thought about who had access to Park's institutional login. She was still thinking when Purcell came through the door at 7:41 p.m., moving fast and not alone. Torres was behind her, and behind Torres was Winslow, and behind Winslow was a man Lena had not seen before, older, with the bearing of someone who outranked Purcell without needing to announce it. "This is Special Agent in Charge Daniel Rourke," Purcell said. "He came in from Denver this afternoon." Rourke looked at Lena with the assessing directness of someone who had been briefed on her and was now updating that briefing in real time. "What exactly did Hess say?" he asked. She repeated it precisely. The words, the pacing, the specific phrase "someone in this hospital who hasn't been looked at yet." She had a good memory for spoken language, always had, and she gave it to him exactly as it had come through the phone. Rourke looked at Purcell. "Get me the administrative access logs for the last 90 days. Full system, not just procurement." "Already requested," Torres said from the door. "And I want someone at Kramer County with Hess in the next 30 minutes. Not a phone call. In person." Winslow was looking at Lena. "Did he say anything else? Any other detail?" "He said they know we're coming." The room absorbed that. Whoever the person was, they had either been told about the investigation's progress, which meant they had a source inside the federal team, which was a different and serious problem, or they had drawn their own conclusions from Doyle's arrest and Price's detention and the visible presence of federal agents in the building all day. The second option was more likely and slightly less alarming. You didn't need a source when the DCIS had been walking the corridors since 6 in the morning. "They've been in this building today," Lena said, "watching the same thing everyone else was watching." "Yes," Rourke said, "which means if they were going to run, they'd have run already. They're still here because they think they're protected." Rourke looked at her for a moment. "What makes you say that?" "Because Doyle is in custody, and Price is cooperating, and there are federal agents in the conference room on the second floor, and whoever this person is, they haven't activated an exit. That's either because they don't have one, or because they believe they don't need one." She paused. Someone who has operated this carefully for 22 months doesn't stay in a building that's been compromised unless they believe the compromised parts don't lead to them. Rourke's expression did not change, but something in the quality of his attention shifted. The administrative access logs, he said to Torres. Specifically, I want to know who has had access to the legal department's institutional credential system in the last 60 days. The logs came back at 8:19 p.m. Lena was not officially in the room for what happened next. She was in the corridor outside the conference room door, which was open by approximately 4 inches, and she could hear clearly because the building was quiet and sound carried. Torres's voice: the legal department credential pool was accessed 11 times in the last 60 days by authorized users. One access, 38 days ago, came from an IP address that does not match any registered hospital device. It was routed through the hospital's guest Wi-Fi network. Rourke: guest Wi-Fi. So, someone physically in the building. Torres: yes. And the access was brief, 4 minutes, long enough to pull a specific personnel record. Purcell: Carver's record. Torres: Carver's record. The query was very specific. It requested service history, specialty training classifications, and current employment status. A pause. Winslow: they were checking whether she'd recognize what they were moving through the supply chain. Torres: the guest Wi-Fi log for that access point. It's the Wi-Fi router covering the 3rd floor east corridor, the administrative wing. We can narrow the physical location to within about 40 feet. Rourke: who has offices in that corridor? Torres read a list. 7 names: department heads, administrative directors, 1 consulting physician. Lena stood in the corridor and listened to the list, and when the 6th name came, she was still. And when the 7th name came, she was already moving. She pushed the door open. Whitfield, she said. Everyone in the room looked at her. Pam Whitfield, director of nursing. She kept her voice controlled. Her office is in the 3rd floor east corridor. She came to the surgical floor this afternoon and told me the review was closed and asked if I wanted to return to the ER. She looked at Rourke. I thought she was being accommodating. She was finding out how much I knew. Silence. She also asked for my personnel file, Lena said, after Purcell contacted administration at 0800. Whitfield saw the federal involvement coming, and she wanted to know what the investigation had on me, because what the investigation had on me was connected to what the investigation had on her. Rourke looked at Torres. Whitfield is still in the building? Torres was already on his radio. The thing about institutions is that they protect themselves. Lena understood this not as cynicism, but as observation. The way a body generates scar tissue, not to harm itself, but because scar tissue is what the healing mechanism produces when the wound is deep enough. Institutions did the same thing. They closed around damage, they classified, they reassigned, they wrote reports that were acknowledged, and then filed in directories that nobody revisited. Pam Whitfield had understood this better than most. She had been director of nursing at Harmon Ridge for 9 years. She knew every channel in the building, every chain of accountability, every gap in the oversight architecture that a sufficiently credentialed person could exploit without triggering the system's reflexive self-protection. She had not been building the network. Rourke would establish later that she had been recruited into it 4 years ago through a consulting contract offered to the hospital's administrative division that had given a defense procurement company legitimate access to the facility's operations. But she had been sustaining it. She had been the institutional cover. The person inside the hospital who could route communications, suppress inconvenient reports, and ensure that a trauma director with a sideline in supply chain fraud continued to have the administrative protection he needed. She had also been the person who received Lena's inventory discrepancy report 6 weeks ago, before forwarding it to Doyle, which was the detail that Rourke's team established at 9:04 p.m. from the internal email record. They found her in her office on the 3rd floor east corridor at 8:34 p.m. She was at her desk. The office was orderly in the way it always was. Not staged, not cleared, just the ordinary organization of a person who maintained her workspace as a reflection of her professional identity. She had a cup of tea on the desk and a report open on her computer, and she looked up when Rourke and Purcell came through the door with the particular expression of someone who had made a decision about how this moment would go. She looked past Rourke. She looked at Lena, who was in the doorway. The expression on Whitfield's face was not what Lena expected. It was not fear. It was not the defensive performance of someone caught. It was something more complicated than that. A tiredness, a specific kind of recognition. The look of a person who has been maintaining something heavy for a long time and has just put it down. "I'd like to call my attorney," she said. "Of course," Rourke said. She made the call. She was calm throughout. She set the phone down when it was done and folded her hands on the desk and did not say anything else until the attorney arrived 40 minutes later. She did not look at Lena again. Whatever she had communicated in that first glance had been the whole of what she intended to communicate, and everything after that was for the lawyers. Lena stood in the corridor while Whitfield was formally detained and walked out, and she felt none of the things she might have expected to feel. Not vindication, not anger, which she had not allowed herself in any concentrated form throughout all of this because anger was expensive, and she had needed the cognitive resources for other things. What she felt was closer to grief. Not for Whitfield, not for any of them, but for the amount of careful, deliberate harm that had been done inside a building that existed to do the opposite, and for how long it had been happening before anyone had found the thread. Winslow appeared beside her. "You okay?" "Yes," Lena said. Which was true and not the whole truth, and Winslow, who was a perceptive person, seemed to understand that the two things were not mutually exclusive. "Go home," Winslow said. "Actually, go home this time. Sleep. Hess is monitored, is stable, and will be there tomorrow." Winslow looked at her. "You've been in this building for 15 hours. Lena looked at the corridor, at the ordinary hospital light and the ordinary hospital sounds, and the fact that it was 9:17 p.m. on a day that had started at 4:15 a.m. with a box on the closet floor and a photograph of 7 people squinting into a sun that had been relentless. She went home. She slept. The weeks after that moved differently. Not faster, not slower, but with a different quality. The way a room feels after you've moved the furniture. Same dimensions, same light, but your body navigates it by different landmarks. Doyle's cooperation agreement with the U.S. Attorney's Office was finalized in the 3rd week of November. He provided 6 names, as promised, and Fielding's team verified 5 of them as actionable. The 6th was a redundancy they had already established. His sentencing recommendation was for 12 to 18 years in federal custody on charges that included conspiracy to commit fraud, obstruction of justice, and material support of an attack on military personnel. His attorney would argue for the lower end. Nobody who reviewed the evidence expected him to succeed. Price received a reduced charge in exchange for his cooperation. He had provided the complete supply chain documentation and had testified to the full scope of his role, and Fielding had assessed him as a person recruited under financial pressure rather than someone who had understood the full scope of what the materials would be used for. He would serve time. He would lose his career. Those were the consequences of the choices he had made, and the fact that he had not fully understood the endpoint did not remove them. Staff Sergeant Patricia Knoll at Fort Braxton was court-martialed. The proceedings were separate from the civilian prosecution and moved on the military's timeline, which was its own timeline. The details were not public. The outcome, when it came, was. Pam Whitfield entered a not guilty plea and retained a defense team that was expensive and capable. The case would take time. Cases like this always did. Lena followed it at a distance, reading the filing updates when they appeared in the public record, and she did not allow herself to build expectations about outcomes because expectations were a way of giving a situation a claim on your internal weather, and she had spent too many years managing her internal weather deliberately to start giving that away. What she allowed herself instead was the slower, quieter work of being present in the building she had stayed in. Hess was transferred to Harmon Ridge's ICU in the 2nd week of November, a decision based on the quality of the facility and his improving condition, and Lena was not his nurse. He was an ICU patient, and she was a floor nurse. But she walked by his room once a day, the way you walk by things that matter, without making a ceremony of it. On the 8th day of his transfer, he was awake enough to have a conversation. She knocked on the open door. He was propped up slightly, still connected to more monitoring equipment than any person wants attached to them, gray-faced and thinner than the photographs in the investigation file, but alert in a way that was unmistakable. The alertness of a person who has come back from something and is paying close attention to everything now because they understand, in a new and physical way, that paying attention is not guaranteed. "Carver," he said. "Colonel." She stopped in the doorway. "Come in, please." She came in, sat in the chair by the window. "I heard what you did," he said. "The bay, the toxidrome management, all of it. I was doing my job." "You were doing considerably more than that." His voice was still rough, but the precision was back in it. The particular precision of someone accustomed to using language accurately. "I also heard you were suspended when the first convoy came through. Reassigned." "Punished," he said, "for saving the first patient, and then you went back anyway when the second convoy came. Despite the reassignment, despite the complaint, despite a termination packet with your name on it." He looked at her. "Why?" She thought about how to answer that honestly and found that the honest answer was not complicated. "Because the patients were there," she said. He was quiet for a moment. "I want you to know," he said carefully, "that the documentation I brought, the records from inside the network, would not have mattered if the investigation hadn't already been built around what happened in your trauma bay," Winslow told me. "The whole thing was triangulated from your treatment records, the toxidrome diagnosis, the inventory report, the timeline of the complaint against you." He paused. "You were the thread." "I filed a supply discrepancy report," she said. "You filed a supply discrepancy report that told them their operation had been noticed, which moved their timeline, which put the attack in front of you specifically in a trauma bay where you diagnosed what no one else was prepared to diagnose." He looked at her steadily. "You can call that coincidence. I've been in enough situations to know what it actually is." "It's doing your job," she said. "Carefully, consistently, even when no one is watching and no one is going to thank you for it." Hess was quiet. "Yeah," he said. "It is." The formal military recognition came in the first week of December, which Winslow described as fast for the military, which Lena took to mean it had been deliberately expedited. It was not a public ceremony. She had been clear about that preference, and Winslow had been clear in passing that preference up the appropriate chain. What it was instead was a letter, signed at the appropriate level, acknowledging her actions during both convoy incidents and the role of her clinical decisions in the outcome of the investigation. She read it once. She put it in the box in the closet. Not buried. It went on top of the folder, visible, accessible, but not on the wall. She was not a wall display person. She never had been. What she was, it turned out, was a department meeting person. The meeting was in mid-December, convened by the interim hospital CEO. Pulaski had taken a medical leave that the hospital's board had quietly converted to a departure, a consequence of the institutional liability review that followed the investigation's conclusions, and it addressed, among other operational items, a proposal for a new training initiative at Harmon Ridge. The proposal was for a chemical and biological casualty response protocol, adapted from military medical doctrine for civilian hospital use. A training curriculum for emergency and trauma staff that addressed the specific gaps the convoy incidents had exposed. A designated coordinator position that would work across the ER, ICU, and surgical departments. Lena had written the proposal. She had written it over 3 evenings at her kitchen table, methodically, drawing on everything she knew from both lives she had lived, the classified one and the civilian one. And she had written it not as a credential display but as a practical document, the kind that could actually be implemented by real nurses and real physicians working real shifts in a real hospital. Sandra had read a draft of it. Tomas had read a draft. Meta, the surgeon who had taken Hess to the OR, had read a section on surgical considerations and sent back 2 pages of notes that were sharp and useful. The interim CEO approved it in the meeting without significant revision. The coordinator position was offered to Lena. She accepted it. Not without thinking. She took 2 days, sat with it the way she had learned to sit with important decisions, let it settle. But she accepted it. Because the hospital was the place she had chosen 3 years ago for reasons she had not fully articulated even to herself, and the reasons turned out to be better than she had understood at the time. This building needed the thing she knew how to build, and she was, it turned out, someone who stayed. 3 days before the winter solstice, the shortest days of the year, with the mountains white to the midline, and Dunmore Falls quiet in the particular way of small cities in deep cold, Sergeant Colton appeared at the hospital's main entrance. Lena was crossing the lobby with a coffee and a folder when she saw him. He was out of uniform again, civilian clothes, and he looked like a person who had been thinking about something for a while and had finally arrived at the place where the thinking had to become a conversation. I hoped I'd run into you, he said. You could have called. I know, this seemed like it needed to be in person. They sat in the lobby, in the chairs near the window that looked out at the parking lot, and beyond it, the road into town, and beyond that, the distant white edge of the ridge. I owe you an apology, he said. A real one. Not the thing I said at the nurse's station, that was me trying but not getting there. You were working with what you had, she said. I blocked you from treating Delgado because you were a nurse, and I was making assumptions about what a nurse could do. And I had no basis for those assumptions except that I'd never thought about it. He looked at her directly. That's not an excuse, that's just what it was. She looked at him. He was not comfortable. He was making himself have this conversation anyway, which she respected. The assumptions you made, she said, are the same ones that made it possible for me to do what I did for 7 years without anyone looking too closely. Nobody expects much from the person they've underestimated. There are worse cover stories. She paused. Delgado survived. Trent survived. Hess survived. Hold on to that. He nodded. Not relieved. She had not said it to relieve him, but with the gravity of someone accepting something they intended to carry differently going forward. Ashby wanted me to tell you something, he said. Private Ashby. He was in the Bay when you treated Delgado. I remember him. He said he's re-upping, another 4 years. Colton looked at her. He said he decided because of what he saw that night. He said he saw what it looks like when someone doesn't back down because the situation is hard, and he wanted to be that person. A brief pause. He wanted you to know. She looked out at the road and the ridge. Tell him to be careful, she said, and to listen to the medical staff. Colton's face did something that was almost a smile. I'll tell him. He left. She sat in the lobby for a while after, finishing her coffee, watching the parking lot. 2 nurses were coming in for the morning shift, talking to each other about something that made one of them laugh. An elderly man was being helped through the entrance by a younger woman who might have been his daughter, the careful navigation of someone with unsteady legs being matched by someone who knew his particular unsteadiness and where to put her hand. The ordinary work of a hospital on an ordinary December morning. Gerald was discharged on a Thursday. His daughter came to take him home, a brisk woman in her 50s who had driven 4 hours and was managing her relief at her father's recovery by being very organized about the discharge paperwork. Gerald bore this with the patience of a man who had been married for 41 years and understood that the people who loved you sometimes expressed it by managing logistics. Lena came to say goodbye. He had the recipe written out on a piece of paper, Eleanor's beef stroganoff, in handwriting that was careful and slightly unsteady, the handwriting of someone who had taken care to get it right. She always said the trick is the sour cream, he said. You don't cook it. You add it at the end, off the heat, and you let it warm through from the residual. If you cook it, it breaks. I'll remember that. You probably won't make it, he said, with the accuracy of someone who had been paying attention. But you'll keep the recipe. She looked at him. Yes, she said. I will. He patted her hand once. He let his daughter manage him into the wheelchair. He looked back at the door as they went through it, the way people look back at places where something important happened to them. And then he was gone. She folded the recipe and put it in her jacket pocket. At the last nursing staff meeting of the year, Sandra stood up and said something that she had clearly been turning over for a while, because it came out with the slightly rough edges of a speech that had been rehearsed but not over-rehearsed. She said that she had been in emergency nursing for 17 years, and she had seen a lot of situations where the protocol and the patient were in conflict and someone had to choose, and the reason she was still doing this job was that she had been surrounded, mostly, by people who chose the patient. She looked at Lena when she said it. She didn't make a production of it. She just looked, briefly, and then kept going, and what she said next was about the new training protocols and the scheduling adjustments for the new year. But the look was there, and Tomas caught it, and the 2 travel nurses who had arrived in October caught it, and the room had that particular quality of people being oriented to something that had happened in it before they arrived. Lena did not speak in the meeting. She sat at the end of the table with a pen she wasn't using and listened, and when it was done she helped stack the chairs. Tomas fell into step beside her in the corridor. How's the curriculum coming? He said. Slow, good slow. Need a second reader on the decontamination section? Yes, actually. Send it over. They walked the corridor in the comfortable silence of people who had been in a hard situation together and had come out the other side still able to be in the same hallway without it being weighted. That was not a small thing. Lena knew it was not a small thing. She went to Hess's room one last time before his discharge, which happened in the 3rd week of December, ahead of schedule, because he was a difficult patient who pushed his recovery with the stubbornness of someone accustomed to operating on the edge of his physical capacity, and was driving the ICU staff to the edge of their professional patience. He was sitting up, better color. The monitoring equipment was down to 1 lead. "I hear you're leaving," she said. "Tomorrow. They're very happy to see me go." He said it without apology. "I'm not good at being a patient." "Nobody is." "You are," he said. "You're good at managing people who aren't." She sat in the chair. "What happens next?" she asked, with the investigation. "Trial prep. The defense contracts case will take 2 years minimum. Doyle's information will help, but it won't accelerate the calendar. That's not how it works." He looked at her steadily. "But it will hold. The evidence is solid." "Whitfield?" "Her team will argue she was a peripheral actor. She wasn't, and Purcell's case establishes that, but trials are long." He paused. "Justice is slow." "Yes." "It gets there," he said. It was not consolation. It was his honest assessment, and he was a person whose honest assessments she had come to value. "I know," she said. She stood to go. He said her name, not her rank, her name, and she turned. "I've been in the service for 23 years, he said. "I have worked with a lot of medical personnel in a lot of situations. I want to tell you something, and I want you to hear it the way I mean it, which is not as a compliment, because compliments are about feelings, and this isn't about feelings." She waited. "What you did in that trauma bay, both times, and then the 3rd time on the floor when nobody was watching and there was no emergency, and you were still paying attention, that's not trainable. That is a person choosing, consistently, to do the harder thing when the easier thing was available, and then choosing again after they penalized you for choosing." He looked at her without sentiment, with the clear-eyed quality of someone who had been in enough situations to know what they were looking at when they saw it. "That is the rarest thing." The room was quiet. She did not deflect. She did not minimize. She had spent a career in a specific kind of invisibility, partly by necessity and partly by preference, and she understood the difference between humility and erasure. She let what he said be what it was. "Thank you," she said. "Take care of yourself," he said, "and take care of this hospital. It needs someone who's willing to notice things." She walked out of the room. On the last working day before the year ended, she stood in the trauma bay after her shift, alone, the monitors at standby, and the equipment stowed in the room carrying the particular quiet of a space that was always prepared for what came next, rather than resting from what had just passed. She had spent 22 years in 2 different versions of the same work. She had kept people alive in places no one talked about, and then she had kept people alive in places everyone walked past without thinking. She had been classified and she had been ignored, and it turned out both of those things felt the same from the inside, like standing in a room where the walls knew what you were capable of, and the people in it hadn't looked at the walls. She was done with invisible. Not loudly, not in the way of someone making a point. Just done. The way you are done with a thing when it has served its purpose, and the purpose no longer applies. She was the coordinator of emergency response training at Harmon Ridge Medical Center. She was the nurse who stayed when staying was harder than leaving. She was the person who filed the inventory report and told the truth on the complaint form and walked into the trauma bay when she was supposed to be upstairs, not because she was brave in any cinematic sense, but because the work in front of her was real and the person doing it was her. She turned off the bay lights on her way out. Outside, the Wyoming night was clear and cold, and the stars were the kind of dense that only happens when the air is fully dry and the light pollution is low, and she stood in the parking lot for a moment and looked up before she got in her car. She thought about what Ashby had told Colton, that he had seen what it looked like when someone didn't back down because the situation was hard, and he wanted to be that person. She had not done what she did to be seen. She had done it because it was the right thing, and it was her particular capability, and the 2 facts arrived simultaneously in the same room, and what else do you do in that moment except act? But maybe that was the thing, she thought. Maybe the being seen was not separate from the doing of it. Maybe every time someone acts from genuine competence and genuine care, In the small rooms and the loud ones, in the assignments no one watches, and the emergencies everyone watches, the record exists somewhere. Not in files, not in citations. In the people who are in the room, in what they carry out with them. Corporal Trent, who was recovering in Missouri and had texted her twice in December with updates, because he was the kind of person who texted updates. Private Ashby, re-enlisting. Sergeant Colton, who had come to the hospital in civilian clothes to say a thing that was hard to say. Gerald, with his recipe in her pocket. Hess, with 23 years of service and the specific clarity of someone who had looked at hard things long enough to see them accurately. The nurses who were coming in behind her. The ones who would take the training curriculum and carry it somewhere she hadn't been yet. She got in her car. She drove home. She was not who they had assumed she was. She had never been who they assumed she was. But the gap between what she was and what they had seen had not been the wound she had carried it as. It had been the space she had worked in, quietly and consistently, until the work itself made the gap impossible to maintain. She was Lena Carver. She was the nurse who stayed. And in the end, that had been more than enough.